So, this is the final section of our lecture, which is the treatment of head injury. In this section, we will discuss minor injury and injury of intermediate severity, severe injury, its grading and prognosis, and post concussion syndrome. What is a minor injury? A patient who has briefly lost consciousness, only stunned after a minor head injury. He is fully alert and attentive within minutes of the injury, is said to have a minor head injury. What are the symptoms that can occur in case of a minor injury? They usually include headache, dizziness, faintness, nausea, single episode of emesis, difficulty with concentration, and brief amnestic period that usually recovers in a short period of time. And the patient might also experience slight blurring of vision. In case of a minor injury, there is good prognosis with little risk of subsequent deterioration. Children are prone to drowsiness, vomiting, and irritability even in case of a minor injury. And it is very important to get a CT scan in case if the patient is a child. If a patient is experiencing vasovagal syncope, it may cause undue concern, so a CT scan should be obtained in that case as well. Generalized or frontal headache is also associated with a minor injury. After several hours, patients are accompanied home and they are observed for a day by a family member in case of a minor injury, and they are given written instructions to return if the condition worsens or if they experience any signs and symptoms. Persistent severe headache and repeated vomiting and no focal neurologic signs indicates that the head injury is benign. CT should be obtained with longer period of observation in case of a minor injury. Now, the decision to perform imaging tests depends on impact severity, seriousness of other bodily injuries, and degree of surveillance. We usually do not perform CT scan in every patient presenting to us with a minor injury. So, if the impact severity is too high or too much, he's also complaining of pain in other parts of the body, or he's complaining of any abdominal pain or vomiting, or in order to get the degree of surveillance, we should perform a CT scan. Now, what are the sensitive findings that make a CT scan must? These include older age, two or more episodes of vomiting, more than 30 minutes of retrograde or persistent anterograde amnesia, seizure, concurrent drug or alcohol intoxication. These are all the sensitive findings. We should, if they are present, we should get a CT scan. Now, what is concussion in sports? Whenever a person is playing and he gets a concussion, remove the individual from the play immediately, because we do not know the extent of concussion or the extent of damage that concussion might have caused. Avoid contact sports unless all symptoms are resolved and the patient gets checked by a physician. Once the person or the sportsman gets cleared, they can begin graduated program of increasing activity, starting from slow to increasing the severity or its the time period of the sports. Now, there is a term dementia pugilistica. Whenever the boxers have mental decline in their careers, late in their careers, they are termed as dementia pugilistica. It occurs due to repeated concussions, and delayed and progressive cognitive disorders are associated with it. And there is deposition of tau protein in the cortical neurons, which can lead to these to the development of this dementia pugilistica. This whole syndrome with delayed and progressive cognitive disorder and deposition of tau protein is termed as chronic traumatic encephalopathy. This is the image of a normal brain, and this is the brain of advanced chronic traumatic encephalopathy with the deposition of tau protein in the cortical areas. Moving on to the injury of intermediate severity. Patients who are not fully alert, who are persistently confused, they are exhibiting behavioral changes. There is extreme dizziness. We are also seeing focal neurologic signs such as hemiparesis. They are said to have injury of intermediate severity. Admit these patients immediately. We usually found a cerebral contusion or hematoma in case of an intermediate injury. Whenever there is an anterior temporal lobe contusion, the patient might exhibit delirium with a disinclination to be examined or moved. They will have an expletive speech, and they will resist if they are disturbed. In case of inferior frontal and frontotemporal contusions, the patient will exhibit a quiet, disinterested, slowed mental state, also known as abulia, which is alternating with irascibility. Due to subdural hematoma or convexity contusion or carotid artery dissection, a focal deficit such as aphasia or mild hemiparesis will be present in the patient. Medial frontal contusions and interhemispheric subdural hematoma will manifest as confusion and inattention, poor performance on simple mental tasks, and fluctuating orientation. Labyrinthine concussion, posterior fossa, subdural hematoma, or vertebral artery dissection presents as repetitive vomiting, nystagmus, drowsiness, and unsteadiness. If there is damage to median eminence or pituitary stalk, it will cause diabetes insipidus, which is complicated by drug or alcohol intoxication. Clinically apparent cervical spine injury may also be present in case of damage to the median eminence or pituitary stalk. If the patient has experienced any blast injury, it is usually accompanied by rupture of the tympanic membranes. Now, what are the treatment options that we have in case of injuries of intermediate severity? If we see a hematoma, it needs to be removed surgically. And after the surgical removal, the patient improves over weeks. During first week, the patient's alertness, memory, and cognitive functions will fluctuate. There will be agitation and somnolence. Behavioral changes will be present, and they will be worse at night especially. So in order to treat those behavioral changes, we give them small doses of antipsychotics. Now, what is severe injury? So in case of a severe injury, the patients are usually comatose. Immediate neurologic attention and resuscitation is required in case of a comatose patient. First of all, we will intubate the patient, and after careful intubation, immobilize the cervical spine, because traumatic brain injury is usually associated with a spinal injury. Assess the depth of coma, pupillary size and reactivity, limb movements, and Babinski responses. Cervical spine x-rays and a CT scan should be obtained. Hypoxia needs to be reversed, and normal saline should be used as a resuscitation fluid in preference to albumin. Transport patient to critical care unit if the patient is comatose. Reverse hypoxia and use normal saline as a resuscitation fluid. Surgery and intracranial decompression are very important in case of severe injury. measurement of ICP with a ventricular catheter or fiber optic device in order to guide the treatment. Hyperosmolar intravenous solutions are used to limit the intracranial pressure. Nowadays, approach of removing portions of the skull in order to give brain time to heal is not preferred very much. Prophylactic anti-epileptic medications can be used in order to prevent the long-term sequel. Now, if we grade the severe injury, we use a Glasgow Coma scale of head injury. It varies from the grading goes from 3 to 15. It has three constituents, which include eye opening, verbal response, and best motor response. Each of them is given a point. If the patient is spontaneously opening the eyes, we will give him a score of 4. And similarly, if he is oriented, we will give him a verbal response of 5. And if he is obeying the motor commands, he will be given a score of 6. We will add these scores, and this will This will show us the grade of the patient or the severity of the injury that he is suffering. Now, what is post-concussion syndrome? A state following minor head injury which consists of combination of fatigue, dizziness, headache, and difficulty in concentration. Now, in case of a post-concussion syndrome, as you can see in this flowchart, in this diagram, there is an overload zone and there is a safe zone. In case of an overload zone, headache and dizziness are a result of the brain being overloaded, and when the brain gets overloaded, it gets injured more. And there is a safe zone. If activity level is kept within a capacity at all times, then there is minimal headache and no dizziness, and the brain will heal. So we have to take care of all these points, and we have to prevent the brain from going into the overload zone in order to give it time to heal. A post-concussion syndrome patient will present with these symptoms. It will be asthenia. He might have anxious depression. There will be difficulty with attention and memory and other cognitive deficits. How we can manage the post-concussion syndrome? It is mainly managed symptomatically. We will identify and treat depression, sleeplessness, anxiety, persistent headache, and dizziness. Care should be given to avoid prolonged use of drugs that produce dependence. For headache, we will give acetaminophen, or we can use small doses of amitriptyline. In case of dizziness, we can recommend vestibular exercises, or small doses of vestibular suppressants may also work, such as promethazine, also known as Phenergan. Serial and quantified neuropsychological testing is very important in order to detect a post-concussion syndrome. It documents the improvement of patient over time, and energetic and resilient individuals have the best recoveries. This was all about our today's lecture, concussion and traumatic brain injuries. We have studied the different types, mechanism of concussion, the different types of traumatic brain injury, including the contusions, hemorrhage, axonal shearing lesions, different types of skull fractures, and we have also talked about the acute and chronic subdural hematoma and epidural hematoma. And in the last section, we have discussed the treatment of these traumatic brain injuries. Thank you for watching sqadia.com.